Imagine the state's largest employer, right?
Yep.
A massive institution explicitly designed to, educate the youth and heal the sick.
Right, the core mission.
Yeah, but suddenly they start adopting the playbook
Yeah.
of like a ruthless Fortune 500 corporate raider.
It's a jarring shift, for sure.
It really is. And if you are driving down Nicholasville Road right now,
Mm.
or maybe sitting in gridlock on Limestone, you can't miss the physical presence of what we're talking about today.
Oh, absolutely not. It's everywhere.
The University of Kentucky isn't just a school here in Lexington. I mean, it's the economic and gravitational center of the entire city.
Yeah, the Chandler Hospital complex practically defines our skyline.
Exactly. And because of that massive footprint, decisions made in those administration buildings, well, they don't just stay on campus.
Yeah, they ripple out.
They ripple out, affecting every neighborhood in Fayette County and really reaching all the way out into rural Kentucky.
And, when an institution of that sheer size and deep integration shifts its weight, the whole Commonwealth feels the tremor.
Yeah, and right now, we are feeling a very significant tremor.
We really are. The university is currently executing this seismic wave of internal restructuring.
Which is what we're diving into today. Our mission on this deep dive is to unpack exactly what is happening inside that restructuring.
Because the implications are altering the fundamental relationship between the university, its workers, and the state itself.
Right. We are looking at a massive slate of changes, all converging around a rapidly approaching June 30th deadline.
It's coming up fast.
We're going to look at the sudden shutdown of two incredibly vital community support programs, the abrupt termination of over 900 campus dining workers,
Which is just a staggering number.
and why all of this has escalated into a very public, very tense clash between Kentucky Governor Andy Beshear and UK President Eli Capilouto.
Yeah, to really understand the gravity of the situation, we can't just look at the high-level politics, or the sweeping administrative press releases.
We need the ground-level mechanics.
Exactly. We have to look at what these changes actually mean for real people. Who is losing their livelihood, what the university's proposed replacement programs actually look like, and the underlying financial strategies driving this friction between Frankfurt and the university's administration.
So let's start with the human cost.
Hmm.
Because before we get to the macro-level politics or the million-dollar administrative buyouts, there are highly vulnerable people waking up to a very different reality.
There really are.
I was reading through the recent notices, and there's a program ending on June 30th called the Targeted Assessment Program, or TA.
Right, TAP.
36 employees are going to be permanently laid off.
Yeah.
What exactly did TA do?
Well, T has functioned as a really crucial piece of the state's social safety net. I mean, it was administered through the UK College of Medicine,
Okay.
but it worked hand in glove with the Kentucky Cabinet for Health and Family Services.
So it was a state partnership.
Exactly. Essentially, it was an integral tool for child welfare prevention. So the 36 people losing their jobs aren't, it's standard administrative office workers.
Right, they're not just filing paperwork.
No, we are talking about highly trained assessment specialists and community-based service managers.
So if a family in Fayette County or, out in rural Kentucky is in crisis, what did a TAP specialist actually do? Are we talking about basic counseling?
Oh, it is far more intensive than basic counseling. They provided comprehensive assessment and intensive case management for low-income parents, navigating some of the darkest, most overwhelming challenges imaginable.
Like what kind of challenges?
We are talking about severe mental health crises, acute substance use disorders, intimate partner violence, and severe learning disabilities.
Wow.
Yeah, these specialists go into volatile, high-stakes family situations and try to stabilize the environment. They are the intervention point, trying to keep a fragile family unit together before it completely fractures.
Before it fractures and the kids end up absorbed into the state foster care and welfare system.
Precisely.
I keep thinking about an intervention like that as like structural scaffolding around a fragile house.
That's a good way to put it.
Right. When a house has severe foundational issues, like the acute crises you just mentioned, you put up scaffolding to hold the walls together while the repairs are being made.
It requires intensive structural support.
Exactly. And if you remove that scaffolding too early, the house is at severe risk of just collapsing entirely. And that collapse means the child welfare system taking over. So when UK shuts this down on June 30th, what happens to that scaffolding?
The physical safety net just disappears overnight. UK spokesperson Jay Blanton has stated that the reasoning for the closure is simply that the grant funds have ended.
Just ended.
Yeah, and this really highlights the brutal reality of grant-funded public health initiatives. I mean, the community need doesn't disappear just because the funding cycle ends.
Right. The crises those families are facing don't magically evaporate on June 30th.
No, they don't. The Department of Behavioral Health still exists at the state level, but this specific mechanism of on-the-ground support, this scaffolding, as you called it, is being dismantled.
It's a terrifying call for a vulnerable family to fall off.
It truly is.
But what stood out to me looking through our sources
Yeah.
is that Tapland is not an isolated incident. It's not just family welfare on the chopping block.
Oh, no, not at all.
A major pillar of Kentucky's public health outreach is coming down on the exact same day. June 30th is also the end of the Kentucky Income Reinvestment Program, or KIRP.
Right. KIRPA represents a massive 8-year partnership between the University of Kentucky and the Kentucky Department for Public Health.
Okay.
They've overseen something called the Target 4 project. And just like TAP, it is shutting down, resulting in 61 employee layoffs.
I need you to break down what KIRP actually did, because looking at the timeline, this program was launched in 2018.
Right.
And if you remember what was happening in the state at that time, Kentucky was facing a severe public health crisis. We had over 400 new HIV cases in a single year.
It was a very dark time for public health in the state.
Yeah. And the materials mentioned, KIRP integrated the Ryan White program and syringe services. For listeners who don't work in public health, what do those things actually mean on the ground?
Well, the Ryan White HIV/AIDS program is a federal program that provides a comprehensive system of care for uninsured or underinsured people living with HIV.
It was funding for direct care.
Exactly.
Yeah.
And KIRP essentially acted as the boots on the ground for this across the Commonwealth. They didn't just sit in a clinic in Lexington waiting for people to show up.
Right.
They integrated that Ryan White early intervention with active health education, risk reduction, and targeted outreach.
They were out in the community.
Yes. They collaborated with syringe service programs, which, are critical harm reduction tools to prevent the spread of bloodborne diseases among people who inject drugs.
Okay, so they were actively out there trying to contain an epidemic and connect hard-to-reach populations with medical care.
That was the mission, yeah.
And this is where the official narrative gets a little murky to me. And I want to try to understand the mechanics of how a university makes a decision like this. We have two conflicting messages about why KIRP is ending.
Yeah, the messaging has been a mess.
Right. Janet Collins, the HIV program operations director at UK Healthcare, sent a termination letter to the rapid response team. And these are the critical care nurses providing 24-hour coverage, right?
Yes, the frontline workers.
In her letter, she explicitly cited restructuring within UK Healthcare as the reason for the closure.
Right.
But then UK spokesperson Jay Blanton insists that this is purely about discontinued grant funding. He says the positions are eliminated solely because the funding is gone. So is this a standard funding cliff like TKP, or is this a deliberate institutional pivot?
Well, if we look at how large, complex institutions operate, restructuring and loss of funding are often two sides of the exact same coin.
What do you mean by that?
An institution might choose not to aggressively seek renewal for a grant, right? Or they might choose not to bridge a funding gap with its own general operating budget because their internal strategic priorities are shifting.
Oh, I see. So letting the grant expire is the strategy.
Exactly. That is a form of restructuring. They use the natural expiration of a grant as an opportunity to reorganize or eliminate departments without having to officially, fire people from the core budget.
That makes sense. But the conflicting internal messaging creates massive confusion.
Oh, absolutely. When your operations director tells you it's a restructuring and the public spokesperson tells the press it's just a funding loss, the 61 workers losing their livelihoods are left feeling anxious and deeply frustrated.
It definitely feels like corporate semantics when you're the one packing up your desk after 8 years.
It really does.
But nature abhors a vacuum, and so does public health. July 1st hits, and there isn't just zero HIV/AIDS care in the state.
No, there is a new system stepping in.
Right, something called the LINK Project.
The Linkage Intervention and Navigation for Kentucky program. This new nonprofit initiative launches the very next day, the day after KIRP dissolves.
And what did the university say about this new project?
UK spokesperson Lindsay Travis stated that LINK is designed to improve the health of Kentuckians at increased risk for HIV and hepatitis C.
Okay, so how does LINK differ structurally from the KIRP program we just lost? Is it just the same thing with a new name?
No, the operational model is shifting significantly. LINK relies on deploying community health advocates, or CHAs.
Community health advocates, okay.
Yeah. Instead of the previous structure, these advocates will focus heavily on linkage to care, meaning strategic outreach, testing, and crucially, trying to retain at-risk individuals in medical care to enhance their long-term health outcomes.
Okay, I noticed in the announcement that Link is going to be partially funded by the state, but it will also rely on braided grant sources.
Yes, braided funding.
What is a braided grant source, and why does that matter?
Braided funding is a term used when an organization pulls together various smaller, distinct funding streams to finance a single program, rather than relying on one massive centralized grant.
So you literally braid them together to cover your budget.
Exactly. The challenge with braided funding, though, is that it can be administratively heavy to manage all those different reporting requirements, and, well, it can be structurally more precarious.
Because there are more moving parts.
Right. If one strand of the braid snaps, if one small grant isn't renewed, the whole program might have to shrink its footprint.
Which brings us to the most stressful part of this for the actual workers. UK has said they will attempt to employ the terminated workers.
Attempt is the key word there.
Yeah, they're working with them to see if there are other job opportunities at the university or if they prefer to find employment elsewhere. But the notices made it clear that the position eliminations from KERP are expected to be permanent.
Which is a huge blow.
Yeah, so if I'm a critical care nurse on the rapid response team, there's absolutely no guarantee I'm going to be a community health advocate for LNIC.
None at all. A new program does not automatically mean a one-to-one transfer of personnel.
Right.
The skill sets required for a community health advocate role might differ significantly from the specialized clinical or administrative roles in the old program. And, a braided funding model might simply be designed to support a much smaller staff footprint overall.
I just can't imagine the psychological toll that takes.
That's brutal.
Being told the program you poured your soul into is shutting down, you lose your job June 30th, and a brand new program doing very similar work launches July 1st. But you might be on the outside looking in.
It is a profound disruption to people's lives. And we have to place this disruption in the broader context of the campus because it is happening at the exact same time as an even larger, entirely separate operational upheaval.
Right, let's get into that macro restructuring. Because UK has explicitly stated that the end of these grant-funded public health programs is completely unrelated to the other major staff changes happening.
They've been very firm on that.
Yeah. I keep seeing terms floating around the local reporting like Integrate Blue or the Enterprise Services Partnership. What are those?
Well, Integrate Blue and the Enterprise Services Partnership are essentially the internal umbrella terms the university is using for a massive operational shift.
Okay.
The university is basically reevaluating how it handles its core campus services. The most visible part of this right now involves the campus dining workers. We are looking at 890 hourly workers and 36 salaried workers being terminated.
Over 900 people. That is a staggering number for a single city.
It really is. These are individuals currently employed by Aramark, the private company that has provided food services to the university.
Right.
And UK has chosen to end its contract with Aramark 3 years early. They are currently seeking a new company to replace them.
Okay, ending a vendor contract early is a big deal, but it happens. But the university is looking for a new company to oversee more than just the food workers, right? They are pulling in maintenance and custodial staff as well.
And this is where we see the fundamental institutional shift taking place.
How so?
Currently, many maintenance and custodial staff work directly for the University of Kentucky. They are public sector, state employees.
Okay.
The university is now looking for a vendor or proposing the creation of a new limited liability company, an LLC, to oversee dining, maintenance, and custodial staff all under one roof.
Break that down for me, because this seems like the crux of the entire controversy.
Right.
Why go through the legal headache of forming an LLC to manage people who already sweep the floors and fix the plumbing?
It's all about liability and structure.
What happens to a custodian if they stop working directly for UK and start working for a university-created LLC?
It changes their entire professional foundation. I mean, when you work directly for a public university, you're a state employee.
Right.
That usually comes with access to the state pension system, specific public sector healthcare benefits, and certain collective bargaining or grievance rights.
Oh, wow. Okay.
An LLC, on the other hand, is a private corporate structure. If the university moves those workers off the direct payroll and into an LLC, the university effectively sheds the long-term financial liabilities associated with those humans primarily, pension obligations.
So they get them off the state books.
Exactly. It makes the university's long-term ledger look much cleaner, but the worker is the one who takes on the risk.
Yeah.
They potentially lose access to the state pension system and transition into a standard, much less secure corporate employment model.
Ah. So the university operates leaner, but the worker loses the stability of state employment.
That's just the fear.
When the city's largest employer suddenly attempts to shift over 900 jobs in LLCs, ending contracts early, and simultaneously laying off critical statewide outreach workers, well, the anxiety absolutely spills off campus.
Of course it does.
This perfectly explains why Governor Andy Beshear held a press conference about cafeteria workers.
The political fallout is severe. Governor Beshear stepped in on Thursday, and he did not mince words. He is demanding transparency.
What exactly did he ask for?
He explicitly stated that he wants to know why the Aramark contract was ended before he comments on the new direction. UK hasn't publicly stated if there were performance issues with Aramark, only that the contract is ending early.
Right.
But more importantly, the governor focused heavily on that LLC transition.
Yeah, he said he is deeply concerned about the formation of a new LLC and the proposed move of public sector employees into it.
Because of those lost benefits we talked about?
Exactly. He wants to know if they will have bargaining rights and wants absolute assurances that the workers are being taken care of. But what fascinated me is that his grievances didn't stop at the dining workers or the custodians.
No, he went much further.
He broadened his critique significantly, stating he was losing confidence in UK President Eli Capelouto's administration.
That is a huge statement from a governor. He pointed to several highly publicized administrative decisions. He brought up the controversial hiring of the incoming law school dean, which was pushed through despite vocal opposition from the faculty.
Right, that was a big story recently.
And he also highlighted the contract offered to retiring athletic director Mitch Barnhart, which included an almost $1 million salary payout. He even went as far as warning that a university presidential tenure could, quote, end in a very difficult way.
It feels like a family dinner where you start arguing over the electric bill, but really the argument is about the fact that nobody trusts the person holding the checkbook anymore.
That is exactly what it feels like.
The immediate issue on the table is the 900 dining workers and the custodians.
Yeah.
But the governor is bringing up the law school drama and the athletic department's $1 million payouts to point out a pattern of behavior.
Right?
He's talking about accrued institutional trust and overarching priorities.
Yeah, the dining workers are the catalyst, but the core argument Beshear is making is philosophical. He is urging the university to recognize the people who work hard every day. The dining staff, the custodians, the public health workers.
The people on the ground.
Yes. He explicitly said we need to make sure we're not just thinking about how those at the top are doing. This is a fundamental clash over governance philosophy.
Right, because Capelouto's administration is making moves that look exactly like corporate efficiency.
Ending contracts early, restructuring departments, utilizing LLCs to reduce long-term liabilities.
And Beshear is arguing from the perspective of public sector values, where direct employment, pension stability, and transparency are paramount.
Exactly. And while this high-level philosophical debate plays out in press conferences between Frankfurt and the administration building, the clock is ticking toward June 30th for hundreds of actual people.
The 36 specialists at the Targeted Assessment Program.
The 61 outreach workers at the Kentucky Income Reinvestment Program.
And the nearly 900 dining workers waiting to see who their new employer will be.
Their lives are entirely in a state of suspended animation.
As we wrap up this deep dive, I want to bring it all back to you, the local listener. Tomorrow, as you go about your day, as you drive past that massive Chandler Hospital complex or walk near campus, remember the human layers of this story.
It's so important to keep that in mind.
We aren't just talking about budget line items or like abstract administrative restructuring. We are talking about low-income parents across Fayette County who are losing the case managers that kept their families from collapsing.
Right.
We are talking about HIV outreach workers who fought an epidemic being handed termination notices. We are talking about hundreds of dining and custodial staff waiting in limbo to see if they'll keep their pensions or be absorbed into a corporate LLC.
And we're watching a political showdown echoing from the halls of the state capitol right down to the streets of Lexington.
Exactly.
The decisions made in the coming weeks will fundamentally reshape the employment landscape of Lexington and the public health infrastructure of the entire state.
I want to leave you with a final provocative thought to ponder today. When a public institution becomes as massive, as complex and as economically central to a community as the University of Kentucky is to Lexington.
Yeah.
Where exactly is the line? Where is the line between operating like a competitive, restructuring Fortune 500 business, trying to balance a modern ledger, and functioning as a public community safety net that owes a debt of stability to the people it serves?
That might be the defining question for the modern university.
Something to think about the next time you see that blue and white logo. Thanks for joining us on this deep dive.